have a unique combination of education. I started off in Mexico. Well, actually, I started off in the United States elementary school, then switched to Mexico because my folks were actually traveling around the country. Then I went back to the States, finished my studies there, finished my medical school in Mexico, then ended up in a special postgraduate course up in Boston at Harvard, then came back to Mexico and took a couple of basic advanced surgical courses, and then finally my folks said stop working, and finally my folks said stop studying and start working. Don't give us money, just don't take more away. So that's why I stopped studying and started working. True story. I got into weight loss surgery even before I finished my residency. I finished top honors, top surgeon in my residency. I got a letter from the president, a big check, which was in pesos, so it was basically like $10. And I also got an invitation to this very unique workshop, and they were selecting 5 of the top surgeons in Mexico. And they had 4, and they used that as kind of like the honorary recognition they gave me. So I went to the course, and the gentleman from Belgium was giving this course on banding the stomach for weight loss. Of course, the course back then had very little experience. The course was probably half day because there was no experience on the procedure. So it was just basically slap it on and let's see what happens. So we had a lot of questions. What's going to happen after we band? Well, we don't know, but that's what it's supposed to be, and that was that. So Dr. Belashev, who actually invented the procedure, ended up being kind of like my godfather, and he mentored me during the first number of months, and he then became my godfather at our wedding, and we established a wonderful relationship. He's an incredible guy. And that's how I started getting into weight loss surgery, this unique procedure, and then we started performing a couple. They went pretty well, and then it started catching on, and by 2001 FDA approved the device, and suddenly a huge amount of requests for the surgery, and that's how it exponentially grew. We perform weight loss surgeries at our center and other weight loss procedures that are not surgical. But what does happen is we're 100% weight loss hospital. Nothing else is done. And that's one of the things I moved away from working in hospitals, because hospitals have, first of all, they have infections. They have patients that have priority over you. In other words, if you're having a procedure and there's a patient on the same wing that's having a heart attack or a cardiac surgery, something of the sort, well, they have a priority over you. So here, the only thing we do is weight loss procedures. And when talking about weight loss surgery, we do the basic procedures and some new interesting procedures. The first and most popular procedure is gastric banding by far. Probably because of our reputation and our experience over a decade, but also because it is a procedure that doesn't require so much rerouting, stapling, intestines, etc. But we also do perform other procedures like the gastric sleeve, which is catching on. Patients that are willing to modify their anatomy will consider it as an option, and the gastric bypass. And gastric bypass has a special application on diabetic patients. So those are the 3 procedures we do most frequently, but we also are performing some very unique procedures and producing some interesting results with our research, which we are about to publish.